Okay, so it's an Exime temporary prostatic stent. It's basically for patients that are on a waiting list, 6 to 8 month waiting list periods of time, especially for the UK market. So like NHS patients wait quite a long time. Yeah. What do you do in the interim? Patients are waiting for a TURP. You go, okay, fine. We can look at maybe placing this stent as a temporary prostatic stent. It's purely, remember, temporary. It's not a prostatic stent. So it's purely just between the patient waiting and the actual case. Most of the patients are on normal catheterization. UTIs, 50% of patients will have a UTI at some point in time. If you're talking the UK 6 to 8 months, that means every patient's probably going to have a UTI. The average cost in the UK to bring a patient back from once they get an infection is about £300 with all the medicines and assessments. So it's quite expensive. So what we do is we've got this product, it's fully indwelling, it's within the sterile field, so cross-contamination or infections is pretty much zero. Reason being is, like I say, everything is below the capsule of the tip within the sterile area. Exime is also for patients that may have retention. They want to release the patient and not use a normal catheter, then you could revert to this type of thing. The process of actually placing it, it comes with two or three different dilators purely for the urethra, so they can dilate that to get it into a nice dilation point. They use an anesthetic gel just to sort of localize the area so the patient doesn't feel so much pain and discomfort. And then most of the doctors just use a good size introduction. You push down like this. Yeah, let's just get this down into position. So it's down in position like that. That stops against the tip. You just carry on pushing. You see the picture? It'll divert through the sphincter, through the prostate, and the tip will push into the bladder. You push this down until you can't feel it anymore. The patient must be on the table at 90 degrees. The penis must be 90 degrees to the patient, lying flat on the table, penis held in an upright position, 90 degrees. You must emphasize that, yeah? Otherwise it can cause problems. So 90 degrees, you introduce, you hit the base, the bull bar. This is called the bull bar. It's like a bone over there. Then you know you're on full introducing. Then what you do is you just turn this little plastic piece here and you pull. It basically releases the stent. You just pull the introducer out, you pull that introducer out, and the outer trocar casing out. All you have then is a suture sticking out the tip of the patient. You have your one part there. You have your actual your stent right through the actual prostate. You ask the surgeon then just to lightly give a tug, just until he feels a little bit of restriction on the suture. Then he knows this is directly in position. Then what he does is he takes a scissors and he cuts just below the tip, the capsule, like I was saying. Why? Because then there's nothing sticking out the patient, no contamination or UTI, okay? It's all within the sterile field. Then the patient goes home. Indwelling time is about 1 month. Well, it's not about, it is 1 month. Our recommended is 1 month. In the future, we hope to move it to 2 or 3 months. I'm hoping for 3 months, but we will wait and see what the final results are. When the patient comes back after a month to have it removed, all the doctor does is ask the patient to pee. Straight after the patient's pee, the suture will pull forward. Then the surgeon goes in and he just grabs the suture that's just below the capsule with a little clip, forceps. And all you do is, if you look here, you just give it a tug and a pull and it releases out. So it's very easy to introduce. I believe even sisters could do it if trained correctly and they follow the process, the steps. For us in the UK, we're marketing